Hello. My name is Dr. Alexander Frias. I'm radiologist. I'm on the admin of the web virtual radiology clinic. You can find me looking for the link www.dralexosarrat.com. The purpose of this video is just because I have a lot of patients speaking Spanish. Then I also do several videos in Spanish to explain the diseases because I think that if the patient understand the diseases and how the diseases happen, then they can take care better from itself and just understand and take measurement and this kind of thing. Then I want to share also this information in English to help to my patient speaking English. The topic of today is regarding the lumbar pain and degenerative disease. Just to introduce the topic, we started talking about the anatomy of the lumbar spine. The lumbar spine has several lumbar vertebrae. Each vertebra is formed by a vertebral body, spinous process, transverse process here, and there is a hole also in this hole. There is a protective, or the function of this part of the spine is to protect the the nerve roots. This nerve root is coming from the medullary spine. And between vertebra and vertebra, there is one soft structure named the vertebral disc. This vertebral disc is formed also by two parts, the annulus fibrosus and the nucleus pulposus. This the function of the vertebral disc is just to absorb the heat when you are walking or when you are sitting or when you are standing, just because you know that the vertebral spine is like a column, receive a lot of heat during the life. And the function of the vertebra, for the this is just to absorb this kind of heat. Then what happened? This is formed by high hydration, a lot of water. What happened during the life, and because the overweight and because a lot of factor, or like women walking or standing position, because before we are women, we are animals working for feet, but with the evolution, you know, the human being just start to walking erectus, and this start to receive more weight, and in the evolution of the disc, they lost water and decrease the height. What happened when this decrease the height? Then imagine the vertebral body, or the vertebra, like a table with 3 feet. 1 foot is the vertebral body, the surface, and the other 2 feet is the facet joint. This facet joint is the structure that join the vertebra and vertebra and allow the movement of the vertebral body when you flex, when you move around, something like that. And what happened? Imagine this table, if you reduce the size of the length of the leg of the table, what happened with the table? Just make some inclination, some tiled, and unstable also, instability. Same happened with the vertebral body. Decrease the height of the disc because lost water, and this height decrease, then the vertebral body go toward and make like a start to pulling this structure, that this structure is the facet joint. This tension just make some inflammation in the vertebral body, and this is the first cause of the pain. No, also when the dehydration appear, also there is here in the annular fibrosis some small breaking, a small gap, and this pour or leave some chemical substance. Also, this chemical substance irritate the nerve here, because in this place, in this part of uh, the vertebral, the spine, there are some nerves, and also here And if there is some chemical substance, this chemical substance just inflammate the nerve and appear the pain. This is the first part of the lumbar pain. Then this is when patient feel lumbar pain, not radiate just in this place. What happened? When this pain appear, for any reason, sometime because they decrease the height, sometime because broken the annulus and poor chemical substance irritating the nerve, sometimes because any factor, when the pain appear, what the body or the brain or our body do just contract this muscle, because around the vertebral body, around the lumbar, the spine, there are some muscles that the function of the muscle, yeah, the function of the muscle is just to make the movement. But what happened when this pain appear? Just the body try to fix this movement to avoid the pain. And then this muscle here, this is a paravertebral muscle, just make a strain and contract just to keep the spine without movement. Then what happened? This in the lumbar spine appear straighten or decrease uh, the curvature here. This curvature name is lordosis. It's normal curvature that the spine have. Then this contraction of the muscle. What is the muscle again? This contraction change because the muscle have this is cellular process, and so one kind of respiration, this aerobic respiration. Then this respiration change from aerobic to anaerobic. Then also the muscle leaves some substance named pyruvic acid. This pyruvic acid make more pain and appear like a cycle formed by pain. Remember, starting the pain, uh, irritate the nerve make contracture the muscle strain the lordosis, and this contracture of the muscle become or change the respiration of the muscle from aerobic to anaerobic. This anaerobic respiration just leave more or another substance named pyruvic acid. This pyruvic acid again contract or make inflammation of the on the nerve. The nerve again contracts. Then this cycle, while the sickle is not broken, then the patient will keep with pain. For this reason, when you do one lumbar spine X-ray, you can see striatum of the uh, lumbar lordosis. That means that this muscle is contracted. What happened if you don't stop this contracture of the muscle? The muscle will keep with anaerobic respiration, leaving or pouring this substance, pyruvic acid, and the pain will keep all the time. Pain, 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 pain. Then imagine it, for example, to understand what happened with this muscle. Imagine it when you go to the gym and you work very strong. What happened? The same. The muscle start because have not enough sugar, enough oxygen. Then the muscle change the respiration, the normal respiration, because the cell also has respiration. It's cellular respiration. It's not like when we are breathing. This is a metabolic process. Then when you go to the gym and you just practice very strong sport, this muscle become the respiration to aerobic to anaerobic, and also leave pyruvic acid. And for this reason, when you go to the gym, happen the same. You have pain in the muscle, then you say, oh my God, pain, a lot of pain, because when somebody asks you, you say, no, it's because yesterday or the day before yesterday, I went to the gym and just practiced too much. Then you must decrease the exercise to improve the pain. What happened in the spine? The same. You because but different, because it's because the initial pain just make contraction of the muscle. The muscle is contracted and decrease the vascular flow of the muscle, and this muscle becomes strong, becomes contracted, decrease the vascular flow of the muscle, and the muscle, the cellular muscle, the fiber, just change the respiration to anaerobic and leave this pyruvic acid and make again pain, and this cycle keep happen. And when you just broken the pain, the cycle, then you will improve. For this reason, as treatment, Dr. Moser requests also painkiller, but also relaxing of the muscle. Some exercises is very good for that. Okay, this is the first part of the lumbar. This degeneration. Okay, remember the hydration decrease the height of the disc. The this vertebral body just tight, make pressure on the facet joint. The facet joint is the disease itself, or the cause of the something cause may pain. This pain may contracture on the muscle, and the muscle change the respiration from anaerobic to anaerobic, leave pyruvic acid, and this keep this cycle. And if you don't broken this cycle with exercises, relaxing exercises, with something hot, massage, or medicine, then you never will improve your lumbar pain. Okay, then what happened? If after this height decrease, and you keep this facet joint tension, uh, the body also try to fix the tension in the facet joint. How the body can fix or try to fix? Just uh, thicken the facet joint. Just deposit calcium, and also before fibrosis, thickening of the soft tissue there, the capsule of the joint, and also this problem also painful. Just make pain and start again this cycle. What happened if this problem keep? Just this inflammation become calcification, and just appear this calcic deposit named osteophytes. Osteophytes can itself are painful because it's part of the inflammation of the soft tissue, and also can touch one nerve root. If the osteophytes touch the nerve root, then the patient will have irradiation of the pain to the any of the leg. Then what happened? We finished with the facet joint. Then remember, decrease the height because the hydratation broken of the annular fibrose, poor substance. This substance make inflammation of the on the nerve head, the nerve head itself, and this irritation just make painful. The pain just make contracture the muscle. The muscle contracture change the respiration to aerobic to anaerobic. This anaerobic just pour pyruvic acid like when you go to the gym and practice sport strong, and this pyruvic acid make more painful the muscle, and just appear again the cycle like a cycle. When you broken the cycle, then you will feel better. How do you can just broken this cycle? With medicine, muscular relax medicine, just with exercise, just with massage, just with some physiotherapy, something like that. Depend of the treatment. Then the facet joint make, because this pulling make inflammate also, another source of pain, same cycle, but the facet joint itself, when it's thickened, when it's thick, can compress or can touch the nerve root here. I will show you. Yes, here. Where is? Yes. Look. This is this. Imagine this facet joint thick, touching also the nerve root. That this is the nerve. Okay. This is I take this image from this web. Okay. Okay. Then the evolution of this. What happened? Remember that I told you that this annular fibrose is sometimes broken, make like a gap here, and this nucleus pulpose try to go out. And what happened? Just make like a bulb here, like a pump here, like some yes a bulb here, and let me see. Yes, here. This is now there is because the hydration you see. This is the MRI. In MRI, the fluid is visible T2, high hyper intense. Look here. Look here. This is hyper intense because this is fluid. This is uh, fluid from the spine, and the same. When what happened? This just there is the hydration here and decrease the height and low. Also the intensity of the disc decrease. Look here, there is a avulsion of the disc. Why? Because this pulpose nucleus try to go out through the gap. The gap because the gap is because the hydrated disc is a little more weak and try to go out. Okay, if the pulpose nucleus keep inside the disc, we name this kind of disease contained hernia. Okay, before the contained hernia, there is annulus protrusion or annular protrusion. Why? Because the disc just try to go imagine one disc, then increase the diameter. Okay, the diameter increase and can also compress some structure. And if is compress some structure, again pain, contracture of the muscle, straightening or lordosis, this history again. Then this after the annular protrusion appear the contained hernia is because look here, the nucleus try to go out but cannot because still the annulus is complete. It's not still not full tear. But what happened if look here? This is this herniation. But is this here? Okay, this what happened if this fibrous annulus broken complete? Then this container go out full here, like here, and make compression. This is a nerve rope because in this level, at this level, there is not a medullary spine. There is a nerve rope. Then this is the nucleus. You can see here the nucleus go out and compress the nerve here. Also nerve is compressing. Then this is when, for example, patients say, okay, after one movement I feel very strong pain in on the leg, right or left leg, until the knee, until the ankle, or until the hip, depend of the height of the affected disc. Here, this is one example. This is the same patient with decrease. You look like evolution. Look, this here. This MRI, the two. This MRI have the normal disc here. This is normal. Look how this have a fibrous annulus containing the pulpose nucleus because this is the function of this annulus is like a barrier to keep the nucleus inside and just meet the function of absorb the pain when patient is walking, jumping, sitting, something like that. Then in the evolution of this disease, this water inside is loose, the hydratate, decrease the height like this one, and here, yes, here start to appear some gap here, and this nucleus try to go out and make the first what is the first little problem that this annulus protrusion here, annular protrusion. After that, contained hernia, if keep broken and full broken of the annulus, then the pulpose nucleus go out and just make extruded hernia like this one. This extruded hernia, or also contained sometimes, just compress or press the nerve, and this is when the patient have his lumbar pain with radiation to the right or left leg, depend of the position. Look, for example, this patient, the protrusion, the extrusion, this is extrusion, is on the space L4, L5. That means that nerve root L5 is compressing, then the patient must feel pain until the ankle, right ankle, because it's the right side. What is the good news? That the evolution of this, the bad news, this is very painful. But with treatment, what happened? This as part of this, of course, also keep the same evolution, keep the hydration, and then reduce the size. Then 80% of the patient don't need surgery, or maybe more by my patient. Then if you have herniation, don't worry, just keep following the treatment. If you are obese, decrease obesity. Just if you are doing exercise, don't allow to do exercise, because if you allow some patients just put something in the lumbar spine to avoid movement. No, is this is just temporary resolution. But what happens if you allow, if you avoid to practice this paravertebral muscle? This paravertebral muscle become weak. When the muscle are weak, is worse, because you lost the stability of the lumbar spine. Then don't worry, just follow up the treatment that the doctor requests. Supposedly this herniation will decrease, because the dehydration, that is a normal way of the normal evolution of the disease. Then it will improve with the treatment that doctor prescribed. Just this is the topic that I bring for you. Uh, I hope that you enjoy this topic, and if you like, please, if you like this just click like. If not, dislike. Also, if you want to register in my channel, okay, you can do. I will try to keep just sharing this kind um, of videos in English, also in Spanish. If you have any comment or any suggestion, it's welcome. Okay, then thank you so much. Have a nice day.